Welcome to our video measuring health and education inequality.
The Composite Coverage Index is designed to give a nation one score based on the quality and accessibility of its healthcare system. It's calculated by taking the weighted average of 8 different indicators. So obviously these 8 indicators represent a number of different outcomes. What kind of help is out there for pregnant mothers who need help in the process of delivering their baby? What kind of help is out there for newborn children who need access to essential immunizations, such as measles? And thirdly, what kind of help is out there for those children who are significantly ill with conditions such as diarrhea and pneumonia? How easy is it for them to access emergency healthcare and emergency health treatments? So you're probably wondering how the data is collected. And there's 3 types of surveys. There's a demographic health survey, the multiple indicator cluster survey, and the reproductive health survey.
As you can see from the charts, the orange dots represent the 10th wealth decile, which is the richest section of society, whereas the blue dots represent the poorest section of society, or the first wealth decile. As the chart shows, the orange dots clearly sit on top of the blue dots, meaning that there's a clear inequality within countries as to who can have access to the essential 8 indicators that we discussed previously. We can also see the in-between country inequality by looking at the standard deviation of this data. Amongst the first wealth decile, the standard deviation is 18.1, and amongst the 10th wealth decile, the standard deviation is 8.51 percentage points. Therefore, we can see that when looking at the in-between country inequality, the poorest section of society shows a much greater standard deviation or a much greater level of inequality. This may be because in the richest section of society, most of those people may be able to afford private healthcare, whereas in the first section of society, you are much more dependent on the quality of the government health system and the amount of endowments the government gives you. One potential limitation of the Composite Coverage Index is the lack of data it draws from developed countries. As you can see from the WHO map, the countries shaded in white are the countries with no data. Therefore, we're unable to see the health inequality in developed countries. For example, the American population's unequal access to the social benefits of health. So on that basis, let me pass you on to my colleague who will go through the educational inequalities.